the silver click background.
No, we can. I'm ready, so you can just start.
Okay, cool. Okay. Good afternoon, everyone, once again. So sorry I keep you all waiting. So today will be our second series on the hygiene and infection talk. So previously we actually talked about flu infection and also another lung infection. So for today's series, we'll be talking about vaccinations for seniors, and we will be having staff nurse Bunting and staff nurse Pei Ling that will be sharing with us on today's topic. So just a gentle reminder again that today's health talk is actually in English version. So if you would like to attend our Mandarin version, it will be on next week. So passing the time to you, Bunting and Pei Ling.
Hello, good afternoon, everybody. Good to see you all here. Have you all taken lunch already? My name is Bunting, and together with me is Pei Ling. We are community nurses from SGH, and today we will be sharing with you guys Hygiene and Infection Series 2, Vaccinations for Senior. So this is our content today. What is vaccination? Vaccines available in Singapore. Different diseases that can be prevented by vaccinations. 3 important vaccines for seniors like influenza, pneumococcal, and COVID-19. Side effects and contraindications to vaccination. COVID-19 booster vaccinations. And at the end of the health talk, we will have our quiz and also Q&A sessions. So must pay attention, okay, so that you can answer the questions later. We all know that vaccination is very important and government always encourage us to get vaccinated. But any one of you can tell me what is vaccination? Any one of you would like to answer? So according to Center for Disease Control and Prevention, vaccination...
Sorry, Bunting from Lingkok Baru.
Yes.
Our senior answer, vaccination is to protect our body.
Oh, okay, thank you.
Welcome.
Hello, may I ask you, for the vaccination, is it inject the viruses in our body to train up our immune system?
Yeah, it's correct. But the virus that they inject is a weakened one, not the strong one.
Oh, okay. Thank you. Actually, I wonder what happened.
Yeah. So according to Center for Disease Control and Prevention, vaccination is actually the act of introducing a vaccine into the body to produce immunity to a specific disease. It means vaccines trains our body immune system so that it can fight a disease that it has not come into contact with before. It is a simple, safe, and effective way of protecting us against harmful diseases. Some people may think vaccine is not effective as they still get infected after vaccination. And yes, it's true. You might still get infected after vaccinations because vaccines are not 100% effective at preventing disease. But because your body already got the antibodies, so even if you got infected, the symptoms usually will be very mild compared to those people that are not vaccinated. This slide shows you a few common vaccines that are available and recommended for adults in Singapore. We have influenza vaccines, pneumococcal vaccines, COVID-19 vaccines, HPV vaccines, and HPV stands for human papillomavirus, MMR vaccines for measles, mumps, and rubella, hepatitis B vaccines, chickenpox vaccines, and TDP vaccines for tetanus, diphtheria, and pertussis. Have you all heard about these vaccines before?
Some of them.
Yeah, some of them. So we're going to look into it one by one, okay? So the first one that we are looking into is influenza vaccine. Influenza vaccine, we also know as flu shot or flu jabs. They are vaccines that protect us against infections by influenza viruses. New versions of influenza vaccines are developed every year, sometimes twice a year. This is because influenza viruses mutate and evolve very fast, and last year's vaccine may not protect you from this year's viruses. And the next one that we have is pneumococcal vaccine. It helps to prevent pneumococcal disease, which is any types of illness caused by Streptococcus pneumonia bacteria. And I will explain more about pneumococcal disease later. And the third one is COVID-19 vaccine that gives us protections against COVID-19 virus. And I think most of us here are more familiar with this vaccine compared to others. And I hope you guys like all of you have already got vaccinated. And the next one that we have is HPV vaccines that protect us from getting infection by certain types of human papillomavirus. As we know, HPV infections is a common reason why women develop cervical cancer. So by receiving HPV vaccines, it can significantly reduce the risk of women developing cervical cancer. And next, we have MMR vaccine. It contains weakened live viruses and it protects us from getting mumps, measles, and also rubella. Why is it important to have this MMR vaccine is because mumps, measles, and rubella are infectious disease that spread easily from one person to another just by coughing, talking, or sneezing, and they can lead to serious complications. For example, mumps virus can lead to deafness, infections of the brain, and sometimes sterility. That means you will not be able to produce baby anymore. And measles virus can lead to ear infection, lung infection, seizure, and brain damage. Rubella, also known as German measles, and if a woman gets rubella during pregnancy, it may lead to miscarriage or the birth defect in the newborn. That's why it's very important to get your MMR vaccine. And as part of the Singapore National Adult Immunization Schedule, adults who have not been vaccinated or lack of evidence of past infection or immunity should receive 2 doses. First dose, and the second dose is 4 weeks after the first dose. The next one is hepatitis B vaccine that protect us from getting hepatitis B infection. Hepatitis B virus is spread by direct contact with blood or other body fluids from an infected person. And untreated hepatitis B can develop into serious disease, resulting in long-term health problems such as liver cirrhosis, liver failure, liver cancer, or even death. And as part of the Singapore National Adult Immunization Schedule, adults who have not been previously vaccinated or lack of evidence of past infection or immunity should receive 3 doses. First dose, followed by second and third dose at 1 month and 6 months after the first dose. The next one is chickenpox varicella vaccine. Chickenpox varicella vaccine protects us from getting chickenpox. Chickenpox is a highly contagious infection that caused by varicella zoster virus. It can cause itchy rash with small fluid-filled blister. It mainly affects children, but adults also can get it. So as part of the Singapore National Adult Immunization Schedule, adults who have not been previously vaccinated should receive 2 doses, first dose, and followed by second dose within 4 to 8 weeks after the first dose. And the next we have is TDP vaccines for tetanus, diphtheria, and pertussis vaccine. Okay, so tetanus bacteria produce a toxin that causes lockjaw, resulting in painful muscle contraction, which interfere with breathing and swallowing, and it may lead to death. And diphtheria bacteria cause breathing difficulty, problem with swallowing, heart failure, paralysis, and death. Whereas pertussis bacteria can cause uncontrollable violent coughing, which result in breathing difficulties, as well as problem with eating and swallowing. Diphtheria and pertussis are infectious diseases which spread from one person to another by just coughing, talking, or sneezing. Tetanus is not contagious, but it is a serious disease that can affect our nerve. That's why it's very important to get vaccinated. And as part of the Singapore National Adult Immunization Schedule, this TDP vaccine is recommended for adults with certain medical conditions, with no history of previous vaccinations, or if their last vaccination was at least 10 years ago. Okay, so now we look at influenza. What is influenza, and what is the difference between influenza and common cold? Right. So influenza is a highly contagious acute respiratory illness. The virus can be divided into type A, type B, and type C, and it can cause mild to severe illness at times, can result in hospitalizations or death in some people. So as we know, flu and common cold have similar symptoms, and how you differentiate them is that flu is caused by influenza viruses only, whereas common cold can caused by a number of different viruses such as rhinovirus or adenovirus. Flu symptoms usually come suddenly, and the very common signs and symptoms include high fever, sore throat, coughing, headache, muscle aches, stuffy nose, and some people may have sneezing, nasal discharge, loss of appetite, fatigue, weakness, chills, and stomach symptoms. Stomach symptoms means vomiting or diarrhea, and this is more common in children than adults. Okay, now we'll look at pneumococcal disease. Pneumococcal disease is any illness that caused by Streptococcus pneumonia bacteria. It includes the infections of the lungs, ear, brain, and the bacteria may also go into our blood and cause blood infection. The symptoms of pneumococcal disease vary depending on the infected organ. It can range from low-grade fever, cough, earache, and chest pain to more serious symptoms such as confusion or severe headache. And next, we look into coronaviruses. Coronaviruses are a large family of viruses causing illnesses ranging from the common cold to pneumonia, and they are named for the crown-like spikes on their surface. Coronaviruses can be divided into two categories, those that are more severe and deadly, and those that cause common cold and pneumonia. The more severe and deadly one includes SARS that affected a lot of people in 2003, and the MERS outbreak that we have several years ago, and now the COVID-19, they all actually belongs to the coronavirus family. And other coronavirus that cause common cold and pneumonia include virus like 229E, NL63, or OC43. The symptoms of coronavirus infections include fever, cough, sore throat, muscle aches, breathlessness, and some people may have loss of smell and taste. So in order to stop the spread of the viruses, all of us must get vaccinated, and we should also encourage our friends and family to get vaccinated as well. So this slide shows you how the vaccines work. Often a weakened form of disease is injected into the body, and after the vaccinations, the body will think that the weak virus is a threat and will build up a lot of antibodies, or we also call it a teams of ninja. Then if the disease attacks the body, the antibodies are ready to catch and destroy them. So it usually takes about 2 weeks after vaccinations for antibody to develop in our body. And this antibody provide protections against infection with the viruses that are in the vaccine. So the next one we'll talk about influenza vaccinations. Influenza vaccines protect us from seasonal flu that has potentially serious complications like pneumonia. And it is recommended for elderly that are more than 65 years old and above. Those has chronic medical condition like diabetes, asthma, or heart diseases. Those has weakened immunity system, women at all stages of pregnancy. And it is also recommended for those people receiving intermediate and long-term services, such as those elderly that attend daycare or day rehab. They are also recommended to have these influenza vaccinations yearly. And these pneumococcal vaccinations helps to prevent pneumococcal disease. It is recommended for elderly that are more than 65 years and above, infant as per the National Childhood Vaccination Record, those has chronic medical condition like chronic lung, kidney, or liver diseases, diabetes, or heart diseases, those has weakened immunity system or other medical conditions. And currently there are 2 types of pneumococcal vaccines that are available, PCV13 or PPSV23, and elderlies are advised to take both vaccines. And next, I'll pass to Pei Ling.
Thank you, Boon Ting, for the very comprehensive explanations on the various vaccinations. I hope that all of you can actually have a more improvised understanding on the vaccinations available in Singapore. So moving forward, I will be talking about the very famous COVID-19 vaccination that everyone would have probably been vaccinated or probably have a lot of concern about. So COVID-19 vaccination is actually invented also because of a COVID-19 outbreak a couple of years ago. So I believe that most of you would have already gotten their vaccination done. In fact, I think most of you will have been fully vaccinated with 3 full jabs of COVID-19 vaccination. So there are a few types of COVID-19 vaccinations available in Singapore. So I think the most pioneer batch was initially the Pfizer BioNTech COVID-19 vaccination. So currently, updated information about this vaccine. For Pfizer, vaccination is actually endorsed for individuals as young as age 5 and above. So actually children that are more than 5 years old, they actually can take Pfizer vaccine. And as for Moderna and Sinovac vaccination for now, they are actually endorsed for individuals that are age 18 and above. So for these two types of vaccination, everyone actually can take other than people who are actually younger than 18 years and below. So the vaccinations for both all these types of vaccine is actually given in 2 different doses at the start, the primary dose, with an interval of 21 days, and subsequently 5 months after the second dosage, which is the second dose of the primary vaccination, individuals actually advised to take the booster vaccination. However, it's not advised for them to delay the booster vaccine for more than 9 months after their second dose, as this will cause inefficiency in the protection given. Next. So what are the common side effects of a vaccination? When we talk about common side effects, it's not just talking about COVID-19 vaccination. It's a generalized side effect of all types of vaccination. So people usually develop such common side effects such as low-grade fever, headache, fatigue, nausea, pain and swelling at the injection site, as well as some muscle ache. So don't be too overly worried if you were to have this kind of side effects, because these side effects usually do not last for very long and they usually subside over a few days. Next. So if you'd like to ask me, what are the contraindications to vaccination? Like, what if, is it like everyone in the whole wide world can receive vaccination? Are there certain people who are not suitable for vaccination? My answer will be yes, but it's actually contraindicated only to some people. So people will have severe allergic reaction after a previous vaccination, or when they develop allergies to a specific vaccine that contains, example, an mRNA component, it's not advisable for them to take the vaccine. Individuals with severely immunocompromised will also not be advised to actually receive live vaccines such as MMR or even varicella vaccines. And people with acute fever of more than 38 degrees in the past 24 hours of their scheduled vaccination is actually not advised to go ahead with the vaccination. Next. So let's look at the COVID-19 vaccination suitability. So people who are not suitable for COVID-19 vaccination are people who develop severe allergic reactions prior for previous doses of mRNA vaccination, for example, or people who actually just received an organ transplant or stem cell transplant within the last 3 months, or even patients who are undergoing cancer treatment like chemotherapy, radiotherapy, or immunotherapy are not advised to actually receive this COVID-19 vaccination unless they are being certified or advised by their primary physician that they are certified to be able to go for it. And who are actually suitable to receive COVID-19 vaccination? As I mentioned earlier, for children that are above, that's actually above age of 5, can actually receive a Pfizer BioNTech vaccination. And for individuals that are above 18 years old, can actually receive Moderna or even Sinovac vaccination. And people with diabetes, hypertension, or any other chronic diseases are highly recommended to actually receive their COVID-19 vaccination for protection. Females who are currently trying to get pregnant, currently pregnant, or even breastfeeding can also receive COVID-19 vaccination. And if you were to ask me, how about those who already have COVID? Do we need to actually get the vaccine? The answer will be yes, because it's for additional protection against this virus. So people with COVID-19 infection previously can receive COVID-19 vaccination. Thanks. So where do we get vaccinated if we are keen? So for vaccinations that's actually shared by Boon Ting earlier on, such as influenza and pneumococcal, if some of you actually follow our polyclinics, right, the doctors will have advised you to go for a yearly dosage of this influenza vaccination or pneumococcal vaccination. So places that provide such vaccinations are all CHAS certified GP clinics, or in fact, all polyclinics can actually provide this kind of injection. So it's actually highly recommended for elderly or people with chronic diseases to actually receive such vaccination on a yearly basis for adequate protection. So if you are keen or you have not been scheduled for this vaccinations, do feel free to actually call and schedule an appointment with them. It can be easily arranged. Yeah. As for COVID-19 vaccination, I believe that everyone will have known that the primary dosage is 2 doses with an interval of 21 days, and then followed by a booster vaccination that can be taken 150 days after the second dose, but not more than 9 months after that. So where to get COVID vaccination if you have not done so? Normally, MOH will have actually sent you guys a personal link via SMS to make an appointment to get your COVID vaccination done. Yeah, so if you have not gotten your booster jab done, actually you can click on the link that MOH sent to you guys and just key in your NRIC number, and then you can just select the nearby vaccination center nearest to your place, and then you can select the date and the time where you want to get vaccinated. If you have not received anything, any link, or you would like to actually walk-in is also available as of 17th of March onwards. Before 7 p.m. daily, walk-in is actually available at various vaccination center. So you do not have to make an appointment, just walk in and tell them that you are actually due for your booster jab and then you would like to take, and then they will easily help you provide you with the vaccination. Next. So if you ask me, do I need to pay for all this vaccination? So the good news is, for Singaporeans, most of these vaccinations are highly subsidized. And if you were to hold the above cards, the Trust card, the Pioneer Generation card, the Merdeka card, even the MFBC or Public Assistance card, all these are highly subsidized for you guys. So don't have to worry about cost. Cost is definitely should be the very last thing you all should think of. So subsidy usually ranges from about 50% to 70%, depending on the subsidy card that you're holding on to. And then if in any case you're unable to cope with the payment after the subsidy, MediSave can actually be used to pay off the balance. So don't worry about the cost. Yeah. So as per this slide, what are you waiting for? Get yourself vaccinated, get yourself protected, and it's actually easily resourced. All these resources are actually easily sourced for. You can actually go to the nearest polyclinic to request for it. So now, hope that all of you have been paying attention thus far. Now we have a mini quiz time to actually just check on you guys whether the information that we gave actually have you all retained. So we'd like to ask you all a few questions. So do feel free to unmute yourself and just try out this little quiz. Yeah, so question number 1. I got a flu jab last year. Do I need to get it again this year?
Yes.
Okay, so why is that so? Why do you think that last year you got a jab already, but then this year you got to get it? You got to have it again.
Wait, Uncle, your answer is no. Okay, why is that so no? Okay, one of my senior from Lingkod Baru answer is no. Hello?
Okay, so if the answer, yes, I can hear you. So if the answer is no, can he tell me why he feels that the answer should be no?
The reason because he already got the flu jab last year and is protected.
Okay, understand.
Because,
how about the lady that said yes? May I understand why did you say that you need to get the jab again?
Because the virus may change differently every year.
Okay, so the correct answer is yes. Yeah, because the flu virus, like what you shared, evolves every year. And as we age, or even our exposure to the public, our immunity may decline over time. So even though last year we gotten the flu jab already, it's still highly advisable to get another flu jab again for this year to give the best protection. Yeah, because you see, even COVID-19, we have different variants. So this also applies to our usual flu like influenza and all this. We have different types of influenza. So every year MOH will actually renew all these viruses, and then they might even provide new jabs on it lah. So not like every year you get the exact same jab. The flu jab given to you will be used to actually target different type of variant. So if last year you got a jab ready, this year the jab that you get might be actually targeting another variant lah. So it's highly recommended to actually get a flu jab on a yearly basis.
Hello, may I ask you, are there any side effects?
Okay, so earlier on I shared on one slide. So for side effect, right, it's very common. The common is actually the side effect for all vaccination is likely the same. So side effects such as like fever, you might feel a bit tired, you might have some swelling over at the injection site, or these are common side effects that applies to all types of vaccination. This is a way that our body immune response react to the vaccination. So no matter what kind of vaccination that you get, the side effect it might happen, but it's not like everyone will have it. So it depends on individual. Some might have more side effects, some might not even have side effects. Yeah. I
Hello,
hope that answers your question.
hello. If you don't mind, I ask you, how come after the COVID-19 jab, the blood pressure shooted up very high and needed to send to hospital? That's a case like this. May I know the reason? Is it caused by anxiety or any other reason? Thank you.
Yeah, so for COVID-19 vaccination, right, hypertension is not a very commonly seen side effect from the vaccination. Yeah, so there might be other factors leading to increased blood pressure. Like what you say, it can be anxiety, it can be other factors. Yeah, so but however, having a high blood pressure or elevated blood pressure is not commonly seen in people who actually gotten the high blood pressure or even the vaccination. So I would advise that in such case, better to go and see a doctor, or even like what you say, if it's really you feel symptomatic and all this, have to go to get hospitalized last. Yeah, if the doctor advised so. Yeah, but it's not a common side effect, or it's not even a side effect actually after COVID-19 vaccine.
Okay, thank you very much.
Yeah, okay. So can we move on to the second question for the quiz? Yeah, okay. So talking about side effects, great. We are just right at the question. So what are the common side effects of vaccination? So we have a multiple choice here. Can someone answer? What are the common side effects do you think is
answer?
available nowadays?
Answer is E.
E. Yes, my answer is E.
Okay, my senior answer E.
E.
Yes, correct. So there is no individual side effect. In fact, from A to D, all the side effects that has been listed here are common side effects of vaccination. So most people might experience this after vaccination, but that doesn't mean that it's compulsory that you will get all this. Some people might just have some swelling at the site. Some people might experience headache or fever, and some people, worst come to worst, they will experience all of it. Yeah, so don't worry if like 1 or 2 days after vaccination you will feel a little bit under the weather. This is actually common after a vaccination. Okay, question number 3. If I do not feel well on the day of injection, can I go for my vaccination?
No. No.
My senior answer no.
Okay, why? Why is that so? Any idea why?
Because you might have gotten the COVID already.
Yeah, that I mean that's not wrong. I mean, if let's say someone has already gotten COVID and then recover already, but then they still do not feel well on the day itself, we will also not advise them to go for vaccination. Yeah. So if you are not well, having fever on that day, right, and you still go for your vaccination, right, you actually might develop more side effects because your immunity is actually low. Because when you feel unwell, it means your body is actually fighting possibly another virus or bacterial. So that means your immunity is actually lower, right? So once you go and inject a new vaccine in, and then your antibodies will start to fight them, to react to the new vaccine, it will cause your body to be under extra stress. So because of that, right, you might even experience more side effect compared to when you're well and then you go for the vaccination on its own. Okay, so next question number 4. I think there's a question asking about the cost of the vaccine. So just nice, we are at this question. Do I need to pay for the vaccinations?
For COVID-19, no.
My senior answered no.
No. Okay. So the answer is actually
Yes and no.
yes and no. Yes, correct. Yes and no. Because you are right, for COVID-19 vaccination currently is fully subsidized by the government. That means everyone get it for free. Okay, no matter you are a Singapore citizen or you're a PR or even people who are on work permit, all this, it is actually widely available for free because it's fully subsidized by the government. So for COVID-19 vaccination, there is no need to pay. But however, if you were to ask for like influenza, pneumococcal vaccination that previously Bunting shared earlier in the slides, actually I shared that if you were to hold some of the subsidy cards, or if you're a Singaporean citizen or this, you have to pay, but it's highly subsidized at 50 to 75%. So after that, the rest of the amount that is actually not covered or after subsidy, you actually can pay via MediSave. So it's not a high amount, it's just a very small amount of cost lah. So don't have to worry that even though the vaccination you have to pay, but it's actually a small amount, and then if you really cannot pay, can just pay by MediSave. Okay. So next, who is eligible for subsidy? Who is eligible for vaccination? Any idea?
Question. I think all what? It depends on the age group, I think.
The elderly.
My senior answer all age for Singaporean.
Yes. Yeah, so everyone who do not have any contraindication is actually encouraged to be vaccinated. Okay, so we actually highly, if you go to the doctor, go to the polyclinic, and then they actually advise you to go for the vaccination. So do go ahead with it. Okay. So question number 6. How do I register for vaccination appointment?
Either the chest clinic or the polyclinic.
Okay, yes, that's right.
My senior answered just walk in.
Okay, there's the different types of vaccination lah. Okay, so for influenza and pneumococcal, these two very common vaccination, you either call in to the polyclinic or GP to schedule an appointment. Because if you want to walk in for the influenza or pneumococcal vaccination, I think you can, but then probably you have to wait very long at the polyclinic lah, few hours. Yeah, so it will be advisable to actually call in to actually schedule an appointment. Yeah, so to prevent like long waiting hours or even getting rejected because of the long queue. So for COVID-19 vaccination, you can actually just walk into the various vaccination center. If not, you can actually schedule an appointment via the MOH link sent to you guys. Yeah, okay. So I think quite good. Most of you actually answered correctly. Yeah, so we actually have come to the end of this vaccination talk. So we would like to actually introduce our service to you guys. We are actually the RHS community nurses from SGH. Concurrently, we actually have 31 community nurse posts. So we are actually stationed in 5 different zones: the Teluk Blangah, Chinatown, Katong, Bukit Merah, and Tiong Bahru zone. So we stationed in different community nursing posts at various senior activity care center. So if you are to be keen to actually be reviewed by us or actually have some inquiries for us, do feel free to contact us. with this information as for below. There's our phone number here and the email address. So do feel free to actually contact us if you were to have any inquiries or you need some chronic disease, health education, etc. Okay.
I just want to ask, what about shingles vaccine? Is it compulsory for shingles?
I don't think shingles is compulsory. In fact, it's not very common offered to the public unless when people who seek medical attention or hospitalized for it, the doctors see. Sometimes shingles can be treated just by oral medication. Yeah, but there's actually chickenpox vaccination available lah.
But because I got those people who got chickenpox, they after that they will get shingles lah. But then my doctor told me shingle every 5 years got to do a booster.
Not for everyone. So it's for individual lah. So if the doctor advise you for this, it's probably targeted at your individual condition. So it's not highly offered to the public at the moment right now.
Yeah, because a person who gets, chickenpox can happen once in a lifetime, but shingle can recur. It can happen like twice, 3 times.
Yes, correct. That's right. Yeah, but it's not applicable for everyone. Yeah, so different individuals has different so-called exposure. Yeah, so if you seek medical attention for this condition already, and then the doctor actually recommend you to get vaccinated once every 5 years, then it will be great lah, because it's probably targeted for your condition. Yeah.
Hello, from Lengkok Bahru. Sorry, I have a senior here asking, after booster, will there be another vaccine? Please advise. Thank you.
Or after booster, will there be another vaccine? So recently, the government came out with I will not say an advisory because it's not confirmed for everybody. Yeah, you're talking about COVID vaccine, right? So recently, the government actually did share that for people who have very low immunity and above the age of 80, they actually is eligible for the one more booster jab, which is the, we have the first 2 primary dose, then we have a booster jab, which is the 3rd jab, and then there's a 4th jab upcoming. Yeah, so the duration between the first booster jab and the second booster jab is 5 months. Yeah, so there's not much information released yet at the moment, but the government is actually coming out with it. So nearer to date, I think they will actually release more, but for the moment now, the information that we have is for elderly that are above 80 years old or those with severe chronic diseases or poor immunity, it's actually recommended for them to take the 4th jab, which is known as the additional booster jab. Yeah, but it will have to be 5 months, 5 months interval between your booster jab and now. Okay.
Hello.
Yes.
Hello. Yes, I have listened to the news before. The younger people have the side effect after the COVID-19 jab, vaccination. Is it that have more side effect is better? Is like the immune system being trained up stronger? Is it so? Thank you.
It has not been officially stated that those with more side effects will benefit better from the vaccination, because the vaccination side effects also varies from individual to individual. Yeah, it doesn't mean that people who are younger, they will experience more side effect, because even I myself, when I go for my COVID vaccination, I do not really have much side effect. Yeah, I only experienced like sore arms for 2 days, and then after that it's actually okay already. Yeah, so currently there's no like official statement from anywhere saying that getting more side effect means that you will get more coverage from the vaccine now. Yeah, so rest assured, I believe that once everyone get vaccinated, no matter whether how much side effect you have or whether you have no side effect at all, the coverage and protection from the vaccination is there. All right.
Hello, can I just add on? Hello, can I just add on? So the side effects really varies like according to individuals. Like me and Pei Ling are similar age. She shared that she got like a little side effect, but for me, I think my side effect is more severe, as in the next day my whole body was like aching so badly. So it really depends on, you know, different persons got different side effects lah.
Okay, thank you. Because I don't have side effect, I thought maybe my immune system is weaker. Thank you.
Hi, thank you, Pei Ling and Boon Ting for the sharing. I believe we still have a couple of questions in the chat box. So one is from Daisy. She was asking for, I believe just now you shared on the vaccination cost for the subsidies cost for those with child's card or PG. So she's also checking how much does it cost when if it's like a private rate. Yeah.
Daisy, you would like to know the private rate for vaccination prior to subsidy, is it? Or you would like to know the cost after subsidy? Oh, okay, so before subsidy, the cost for influenza, it can range about for flu jab can be range about $40+, $48 lah. Yeah, so as for pneumococcal, before subsidy, it can be about $90 before subsidy. Yeah, so as I shared earlier on, the subsidy ranges from 50 to 75. Yeah. If you are Singaporean or PR, or even if you hold the above cards, can Boon Ting share back the screen for the subsidy card? For now, we bring back the screen again. If you are not a Singaporean or PR, and then you do not hold any of the cards, I think the subsidy is not available. Yeah. If you are Singaporean, then it's subsidized 50 to 75% and above. So the rest of the balance that it can be used to pay via MediSave. If not, can pay with cash. Okay, hope that answers your question. Yeah, anybody else has any questions for us? We are open for Q&A right now.
So if there's no further questions, right, is there anyone can share about your vaccination experience, like after the vaccinations, what kind of side effects you experience and what do you do to make it feel better?
So everyone feels so good after vaccination. Anyone has side effects after vaccination? Fever, pain, feeling tired?
I think they are a bit too shy to share about their. Oh, I have. Daisy also shared that she has no side effect.
Okay, Daisy shared that she has no side effect, but the doctor says should have side effect because the vaccine is working. Yeah, so I think Boon Ting, you would like to explain why?
Yeah, it really depends on individual. If you don't have side effect, it doesn't mean the vaccine is not working lah. Yeah, you still got the protection. Just that, you know, it's different people really got different side effects one.
I believe that some of us might have side effect, but it's too negligible for us to actually notice it. Also, you thought like, oh, you might be just tired, like you have been working, but then perhaps it's a very mild side effect, but it's too small for us to notice. Also, it's like
Yeah, sometimes you may not have fever, but maybe your body will be slightly warm, but haven't reached the temperature until you got fever yet.
Correct. So all of our body works differently.
Correct. So for my mom, I shared that earlier on I had some sore arm, but my mom, she herself, after getting all 3 jabs, she just feel like she wants to sleep more. Yeah, so after she sleep like for 8 hours and she wake up, she feels okay again. So maybe to her, she might think that, oh, because she do housework or this, so she feel very tired. But then it might also be one of the side effects that she actually might be experiencing for the COVID jab, because one of the side effects is like fatigue and feeling tired. So doesn't mean that you don't feel that very obvious out of the normal kind of like side effect, or you don't feel especially feverish, or you don't feel having headache or this, right? Doesn't mean that your vaccine is not working. So once it's injected, everyone actually reacts to the vaccination differently. So just rest assured, still get yourself vaccinated, because once you get vaccinated, there's a protection there. Okay.
Just a curious check on the ground. I understand that for COVID-19 vaccine, most of us should have taken it. Just a quick check for our seniors. How many of you actually managed to do your annual flu vaccine jab? Because previously when we checked, right, most of our seniors last session, they actually did take their flu vaccine jab. So just to have a quick check, like how many of you here actually take your annual flu jab?
Sorry, your question again. Sorry, what jab? Sorry.
The influenza jab, flu jab. Remember when Pei Ling earlier was sharing if we should take our flu jab annually? I have never taken any flu jab. It is necessary. So, Daisy, what do you mean by it is necessary? Are you checking if it's necessary to take a flu jab annually?
Hi, I have a number of seniors in the center from Lengkok Bahru. I did not take the flu jab. Yeah.
Okay. Pei Ling or Boon Hee, would you like to share if it's necessary or strongly encouraged to take flu jab annually? Sorry, Boon Hee, I think you like to share the slides again. Okay. So yes, according from the slides, right, so it's actually recommended for our seniors to actually take your annual flu jab, so that it can actually also for those who are 65 and above, and also have a lower immunity system so you encourage for you to actually take your annual flu jab as well. So even for our healthcare staff, we also take our flu jab annually as well to actually protect ourselves. And should us have any infection, it will actually be a milder side effect also as compared to those who are not taking any flu vaccine. And
Yes, Felicia, you are right. It's not that you compulsory, like you must go, but it's strongly encouraged to go for a yearly influenza vaccination.
Hi. May I share with you, or may I ask you, okay?
Yes, sure. Please go ahead.
I mean, in the older days, not many people can afford to go to hospital, pay the medical fee. So for the generation, for them like common flu, all this, after a few days will be okay. So like, can it because of that their immune system trained up by themselves?
I think you, Miss Christina, I think you mentioned about the normal common flu, but if you recall our last session about our flu infection, right? Influenza and our flu is actually different. So, Pei Ling or you would like to share more? Like, I think she's talking about sharing about the common flu, but for this influenza vaccine, is influenza as a whole.
Yes, correct. So I think Miss Christina, you will actually check. You actually just correct me if I'm wrong. You're checking that last time in the other generation, people don't have the privilege to actually receive all the vaccination. So you were actually questioning whether their immune system were being like built up on their own because they do not have the privilege to receive all this kind of vaccination lah. So like what Felicia said earlier, like influenza and flu, they are different. Yeah, so influenza actually has many different type of influenza, and from the previous history, influenza, this issue, right, actually has caused quite a number of like severe cases, or even lead to many of the deaths last time. Yeah, even when before these vaccinations were being invented, so many people have actually died from influenza. So flu, on the other hand, like common cold and all this, right? Yes, they might not require vaccination for that. People might recover on their own using their own immune system. Yeah, but definitely it's actually very different from influenza. So do not mistaken influenza as just common cold. So the vaccination that we recommend here is actually vaccination for influenza. For the moment, we have like different types of influenza, like influenza A, influenza B, influenza C. So in the past, it has been recorded that this influenza has caused many severe issues, and even many people have died from it. Yeah, so I would advise you that to get vaccinated against this influenza if possible. And as for common flu and cold, others, if currently there's no like vaccination for this common flu and cold because they are not that severe enough to cause any severe complications or even death. Yeah, I hope that answers your question.
Yeah, it's my doubt for a long time. Thank you.
I understand. Don't worry. Welcome.
Okay, Ling, in view of time, I think we can hold one more question. I see Inhua raise up the emoticon hand. Just to check, Inhua, do you have any questions for our nurses? If you're convenient, you may actually assist us to unmute yourself to share your question. Or you press by accident. Okay, if she's still thinking about it, it's okay. Probably we can take in one more question. If anyone would like to have any last question for our nurse before we end our session for today. If don't have, then no worries about that as well. I hope today we are able to learn a bit more about the different type of vaccinations for seniors itself. And do note that we know we have a lot of misconception whereby vaccination is bad for us. We need to build our own immune system and take less vaccine to our body. But do note that some vaccination actually helps in our body and it actually protects us even better. So do encourage yourself or your friends to actually go for at least the influenza vaccination on a yearly basis if you are actually eligible for it, like those few pointers that we have shared on the slides. Okay, so if you have no other questions, just to share again, for next week, 4th April, is actually our Mandarin version for this talk. So if you would like, you can actually join us next week for our Mandarin version. Then if not, you can join us 2 weeks later, will be 11th of April, which will be our next health topic in English version. Okay, so if there's no further question, once again, thank you, Pei Ling, Boon Ting, and thank you everyone for your participation. And then we shall see you.
Thank you from Lingkok Baru. Thank you.
Thank you all.
Thank you.
Thank you
God
for
bless
attending the
you.
talk.